Hello and welcome to this year's Giant Health event. My name is Barry Shrier and I'm very proud to be introducing you to some leading healthcare tech innovators from Alder Hey Hospital, a leading NHS hospital in England. Once again, I'm the founder of Giant Health, and Giant is an acronym. Giant stands for Global Innovation and New Technology. We have been going for over 7 years, and we are a global community of nearly 200,000 people around the world. Our informal strapline is that Giant is a community of everybody whose business is healthcare, technology, and innovation. Our vision is to improve the health and the well-being of people around the world by facilitating the adoption of new technology in healthcare and supporting healthcare tech innovators. So that's what we're all about. And I'd like to say that one of the things that's a difference about Giant compared to the hundreds and hundreds of other healthcare shows, healthcare conferences, healthcare technology trade shows around the world, the main difference that makes Giant point out is the fact that we're about the people on the floor who are doing the innovation work. We're about the healthcare providers. We're about the hospital managers. We're not featuring government ministers who are talking about plans. We're not featuring management consultants who have advice. We're featuring the real healthcare providers, the real people who are leading hospital innovation and helping the world to showcase the best innovation and to identify the best new technologies which are available and to showcase the evidence that we have about what's working in the world of healthcare. So today I'm very, very pleased to invite you to join us. We have a half-hour fireside chat now with two very senior, very successful innovators in healthcare working for the Alder Hey Hospital. We have Iain Hennessey. Hello, Iain. Good to see you.
Hi there.
And we have Nicki. Hi, Nicki Murdock. Nice to see you. Thanks for joining us.
Hi there. Good to be here.
So what we're going to do is we're going to dive straight in to help our listeners really get to the heart of innovation. So Iain, if I can ask you first, give us an example of a big healthcare challenge that you guys have at your hospital. And can you tell us right away about an innovation that you guys have deployed recently and what has happened with that innovation?
And I'll talk about an area that's really close to my heart, and that's how do you plan an operation? So at the moment, well, before now, we'd be getting CT scans and it'd be quite difficult to interpret them. Could we use more technology to actually make the planning process better? Could you make 3D visualizations? Could you make virtual reality worlds? Could you make 3D prints?
Yeah.
And we found that actually making 3D prints is great for surgeons because we're really tactile people. We like to touch things, like to hold things, and we can make 3D prints of the patient's anatomy to allow us to visualize what we're going to do before we actually do it.
Mm-hmm.
And this was a real revelation for us. About 5 years ago when we first started this and when 3D printing technology was really quite basic.
Yes.
But now with these multimodal printers, the resolution of them, you can create these beautiful 3D prints which allow you to really get a feel for what you're going to encounter when you operate before you get there. And that allows you to do faster operations, more precise operations, operations which you've got more chance of getting it right first time. And it's great to see how the evidence base is starting to emerge from this, about the reduction in operative times, about how people can conceptualize things better, even at the stage.
Mm-hmm.
So for me, 3D printing has been, and 3D visualization and that immersive health agenda has been really one of the standout things the last few years.
Excellent. That's a fabulous example, 3D printing. And so, Nicki, if you can participate in this call as well, please. From your perspective, tell us what some of your own challenges have been recently, and what's a good example of a tech innovation challenge that you've been working on, and how is that playing out?
Well, I think, one of the big challenges for us in healthcare is that when we're working with healthcare professionals, they've got a very different culture from the innovation culture.
Right.
And that can be a real stumbling block because, if I said to you as a clinician, well, yeah, you've given me an idea for an operation, go and have a try and see what happens. And if it fails, we'll have a big celebration. And if it goes right, we'll have a big celebration as well.
Right.
Your clinicians would say, whoa, hold on a minute, Nicki, you're in the wrong job. And I think that's sort of, we train our staff to be perfectionists because we want them to be you know, every time you get an operation, you want that high reliability, don't you? That you're going to get the same result for every procedure. And that isn't how we innovate. You know, there's a very strong sort of culture of, well, we will try, and we know that if we try 100 things, well, 96 will not get there, but that's okay. So it's how we get across that culture to people that, look, we're putting up some ideas. Don't just say no and discount them out of hand. Have a think about them and actually talk about, well, yeah, maybe we should try that, but we've got to be open with our patients and say, we're trying something, we'd like you to be involved in that and see how it goes.
Yes.
So for me, as a leader in the hospital, what I'm trying to do is get people to think outside the box and consider new ways of doing things. So I've been talking to people about shared medical appointments, which in some parts of the world have been going really well. But, you know, it's getting across that barrier that might be a way for us to work with patients, because it would provide more access more quickly for patients, but also because it would allow patients to support each other.
Yes, that's a very interesting innovation, and we'd love to hear a little bit about more of that later on in the conversation. Thank you for sharing that. And so going back to you, Iain, if you can tell us very briefly, what is your role? What is your day job, so to speak? And also tell us about what Nicki just mentioned. This is very interesting. So, of course, there's the famous Silicon Valley mantra, which is work fast, break things, and move on. And naturally, in tech innovation, that can be considered to be an appropriate approach. But I'm assuming that in healthcare, the concept of working fast and breaking things and experimenting and moving on doesn't necessarily fit. So like I said, Iain, number one, tell us a little bit about you and your background briefly, and also about this challenge. Perhaps it is the difference between, of course, the priorities of a clinician on the one hand and the priorities of people working in tech innovation on the other.
Yeah, so I've got a 50-50 job split, basically. Half of it, I'm the clinical director of innovation.
Right.
My job is to try and break down these barriers, find new ideas from other parts of the world, bring them in other industries. The other half of my job is I am a surgeon. So this morning I was operating, and on the weekend I was on call. And that's the way my job is split. And it's really interesting because my mind is split down two ways. Because when I'm a clinician and when I'm operating, I'm risk averse. I'm using tried and tested techniques, which are the correct things to be doing.
Yes.
But when I'm innovating, I'm in that kind of, let's try and come up with a new technique. Let's try and do something new, something different. And you've got to use it appropriately, because obviously you cannot move fast and break things when you're dealing with children's lives. That is not
exactly.
anyone would say is a good idea. But at the same time, we have to move forward, and we have to update the way that we practice medicine. Otherwise, we'll still be bleeding people and applying leeches to people and doing all sorts of crazy things.
Yes.
So trying to get that balance right is absolutely critical. And one of the key things, I think, is doing what's been created at this hospital is creating environments which are de-risked. For instance, simulated environments or areas where you're just thinking through a new idea. You're not necessarily doing it. You're just thinking, what if we tried this?
Yes.
And that produces the kernel, the start of a potential idea, which could then, with all the correct safety measures, be instituted into care. But you've got to have that initial bit of, right, what if we try something else? What if we try something different? And that's so critical. And it's why it's so important to have leaders in the hospital who are willing to encourage that type of thinking.
Yes, yes, absolutely. Well, that's very helpful. Thanks for that explanation. And so, Nicki, what Iain just mentioned, of course, I think is fundamental. So tell us, please, a little bit about your background and your current role, and any more examples about this challenge of managing between the requirement of innovation to get out there and take risks and do new, different things on the one hand, and the obvious requirement for clinicians to be cautious and to work on an evidence-based basis and this type of thing.
Yeah, thank you. So I'm the medical director of Alder Hey, and so that means I've got responsibility for oversight of clinical governance, professional issues, clinical services.
Right.
And I've been at Alder Hey for a couple of years now. I came from Australia. I've been working in Australia for nearly 20 years. I'm a paediatrician by background, and so a GP. But in Australia, you can actually train to be a medical administrator. So I did that training, and now I'm using that here.
Right.
I think, yeah, I think what Iain said about risk is really interesting, because I think my job is to facilitate people to take those risks, and to show them that, yeah, we understand that we're taking a risk here, and what we're doing is making sure that risk is being taken as safely as possible.
Yes.
I see my job as presenting to people ideas and the art of the possible, and then supporting them to explore those ideas.
Yes.
So towards we've just been going through the pandemic, and that's been a very interesting time. One of the things that the pandemic did was it took aside a lot of barriers to the way we work, which was fantastic.
Okay.
How are we going to keep that going? We're working on that. But a couple of months ago, we held a workshop when we talked to people about the different things that are happening. So my job, I feel, is almost to say to people, hey, have you looked at this? Could this work for you? So, you know, in other parts of the world, we've got people taking retinal photographs, and then, doing that remotely, taking a van up into the middle of northern Australia,
Yes.
taking retinal photography, and then bringing it back and showing it to the ophthalmologist who can assess it without actually leaving the town.
Wow.
And so we talked about things like that, about digital otoscopy, so that could we start having GPs looking in children's ears, capturing the images and sending it back to ENT surgeons, who then can see those children remotely. We've done a lot of work around video health, and that's been really successful. We've turned a lot of our face-to-face into video, because we've got Liverpool was actually a hotspot for COVID. So
Yes.
I think trying to show people and then support them, because I think sometimes doing things differently can be really difficult, and you need someone underneath you who's going to help you with time, with resources, with personnel, and a bit of money to get that going. So that's how I see my job. I mean, I do have ideas myself. So Iain has kindly helping me get in touch with some people about 3D printing, because I'm interested in 4D printing, which is where you can print something and then it alters when you apply something to it, whether that be a magnetic force or heat. Yes. Or a different acidic environment, and really
Wow.
Interested in that, and we get a bit more involved in the hands-on stuff there.
Excellent. No, that's very interesting. I haven't heard of 4D printing before, so great to hear and learn something new right away.
Oh, yeah, yeah.
Iain, tell us a little bit about the background, please. We've heard that your day job is as a pediatric surgeon, if I understand correctly, but you're also the founder of what you call it, the NHS Hospital Innovation Hub. Tell us about that, please, and what were some of the challenges you experienced getting that off of the ground?
Yeah, that was just a very happy chain of events, really. Yeah, getting to the innovation hub we have here at Alder Hey. So behind me here, this is the main atrium for Alder Hey Children's Hospital. That is a big tree house.
Wow.
People have described it as a boutique Norwegian airport. But the idea is that it's meant to be friendly and welcome and inviting. And this was built in 2015.
Wow.
This is really the catalyst for, I think, the innovation agenda at Alder Hey, because we had a big disruption. We were moving from an old Victorian hospital, an old designed as a workhouse, with a pediatric wing attached to it for the sick Victorian children.
Yes.
This state-of-the-art spaceship-like, one of the most advanced hospitals in the country. And I was a trainee at the time, and I didn't have a job. They had enough money for a half-time clinical job, someone to make the technology in the hospital great and really geeky and techy. And they were like, "Oh, love that. Get you."
Sure.
And it built from there, and it was fascinating because we got one company on board, and we learned how to speak to companies, and we learned how to work with companies.
Yeah.
And all of a sudden, all the other companies wanted to work with us.
Oh wow!
We
Nice.
Get a bit of a move. Some really big companies as well. I still remember some of the initial meetings. I was like, "Oh my goodness, we're gonna have to find a lot of people to match up in these meetings." But that brought resource, and it brought profile. And it attracted more people into this burgeoning innovation, because we had this new hospital. We had to do things differently. We had to change. And it started to build from one person and an assistant to some more clinical people to, I think now there's 22 people working in our innovation hub. We have 1,000 square meters of space deep underneath the hospital. It's like, the nickname is the Bat Cave. Where we check out all the new types of technology, and we do all our co-creation down there, and we work with partners in academia to imagine what could be and then try to build it.
Right. That's excellent. It's such a great success story. And tell us a little bit more, Iain, very briefly about Alder Hey itself, in case any of our visitors, for example, from overseas are not aware of the group.
So Alder Hey Children's Hospital is a very special place. It's in the outskirts of Liverpool. We've been going since 1912, and we've been looking after all the children in Liverpool since 1912. And it feels like a bit of a force field over the city, because
Right.
every single person in Liverpool has either had a niece or a nephew or a child or even themselves treated here at some point, because it's got such an old and rich history.
Right.
And we do everything. So if you fall over and scrape your knee and come to our knee department, we look after you. You need to have heart surgery and super specialist cancer care, you come to Alder Hey. We do the whole shebang, you know. So it's quite nice to have such a defined geographical area, to have the history of it. And also, we've got all the feeder hospitals as well from all the northwest of England and beyond. I think actually we've taken someone from almost every postcode in the country for our specialist care.
Yeah.
So it's a lovely place to work, and it's got a really nice history to it as well, which is the icing on the cake is this new hospital, really.
Yes. Yes, exactly. I mean, it's such a great success, the innovation hub that you guys have put together, and we're extremely proud to be working with you to champion that. So, Nicki, very briefly, with your background in mind as a clinician and your international experiences, and of course the successful work you're doing driving innovation at Alder Hey right now, what's your message to other people in other hospitals, not only here in the UK and in Europe, but around the world? What would you say are some of the challenges that you guys are confronting and successfully learning about how to address? And when other hospitals around the world have the shared ambition of adopting innovation and taking steps ambitiously to improve, what would you like to advise them about from your own experiences?
Well, I think one of the things I would say, and I think, Barry, you and I are testament to this, is that don't expect that innovation is just going to come from the younger staff in your organisation.
Oh, okay.
You know, it can be from the older people. You might find that the older people in the organisation are the early adopters. So
Yes.
up into them as well.
Mm-hmm.
You know, because it's easy to create a job. So a new job like Iain got, which brought him in and he was innovating. But look at your older people as well, because they've got ideas. I think involve your patient group. So for us, that's children and young people, but
Yes.
really involve them and watch that innovation permeate throughout the whole organisation. So for instance, on Wednesday night, we held our annual general meeting. The financial report was presented by the children. And it's just, it made it come to life, because if they could understand it, it meant that everyone else could. And they have a very different take on it, and, you know, different idea of how the money should be spent. So it's really, it enriches the whole organisation if you can get innovation embedded. It's not just about your clinicians, it's also about your non-clinicians. And it needs, I think it needs some, you really need some infrastructure to help with that innovation, because innovation, remember, it's portrayed as that light bulb moment, but actually, you know, there's a way of creating innovation and how to foster how people develop ideas, and that takes time. I think Iain would say this hospital has been open for about 5 years now, and you can really see that in the last year or so, it's really starting to fly. Excellent. As far as innovation is concerned. So think of it as a long-term thing. Don't think of it as, well, we haven't had any light bulb moments this year, so let's shut it all down. It isn't like that. Excellent.
Nicki, that's very, very helpful and extremely informative. What's that phrase? Overnight success comes after 20 years of extremely hard work.
Yeah, that's right. That's
but right. I love the I love the idea of the children presenting the financial report. Does that mean that ice cream is served 7 times a day now in the hospital or something like this?
Well, we do actually have ice cream in the hospital. We actually have our own chef on every ward, because that helps the children, you know, they can have what they want to eat when they want to eat it and so on. So that's another innovation that we've put in. Reduces waste as well. Means the children actually eat because they're not being presented with something that somebody else ordered yesterday.
Yes.
You know, there's innovation in every single step. And when I came here for my interview, the thing that really struck me is that the design of the hospital is
Right.
very innovative, because you walk in and you don't see ill children anywhere. So I think that creates a fantastic environment for the children who have to come to hospital very frequently.
Mm-hmm.
They don't feel they're coming to a horrible place, because we move children from the emergency department to theatre, and back to the surgical ward or the intensive care unit. That's all been designed so that it happens away from the main atrium, so that the children said, we don't want this hospital to look like a hospital, we want it to feel like an airport.
Yes.
And it does, because they helped design it. Again, they were part of the design process.
Yes.
I should be careful, I might lose my job soon. There'll be one of them being medical director.
No, but this is very informative and really worthwhile information. This theme of inclusion that you've mentioned is clearly a cornerstone for the successful identification and implementation of innovation. So it's good to hear about these successful case studies. So Iain, we have about 5 minutes now. So between you and Nicki, if that's okay, we'll do a little bit of a wrapping up. But I wanted to ask you about the future. And do you guys have a clear vision which you like to enunciate? Or if not, do you want to tell us a little more about what your personal vision is for the future of innovation at Alder Hey?
Yeah, well, I think between the two of us, we can definitely tell you where we're going, especially because I'm looking at our main strategy on the wall behind Nicki's
right.
head. But I think personally, one of the big drivers behind this is that this is a hospital that's still full of sick children, and I would like that not to be the case. I think is the long and short. And what is going to be the change? The change is going to be technology. Because that's the thing which is accelerating. That's what's accelerating at an exponential rate at the moment in the rest of the world. Because as doctors, we're not getting any better. Our brains aren't getting upgraded. Our hands aren't getting. I'm not developing a third arm or anything like that. So the way that we're going to that might be technology in itself. But but I mean, realistically though, I was looking at robotic platforms for surgery where you just have a third arm. I mean, so that is for me, technology is the key to how we sort the problem of having sick children, which is something I think that most people would agree we should try to avoid.
Of course.
Now, the actual strategy for how we're going to, because that's a big aim, is how do we break it down? How do we look at all these different problems and decide what we're going to fix? And the two key things that we lifted out for using technology to enable care at Alder Hey was being Alder Hey anywhere. Doesn't matter where you are, we can be there. We can affect care. We can find out if you're well or unwell. Now, that's not just telemedicine. That goes right down to people's data, looking at patterns, where they live, how they're getting on at school. There's 1,000 different ways which we could both find out about people and also be able to deliver care. So there's Alder Hey anywhere. And then the next thing is the world's safest hospital in safety.
Right.
Now, technology has got risks, but it's also got the ability to reduce risk as well.
Sure.
I mean, humans are amazing. They are great at creative work, and they can synthesize data and they have insights, but sometimes we miss things. And the mistake that is made because you missed something, or you didn't take something into account, or it was there all along and you never saw it.
Yes,
that is the worst mistake. As for everyone. Because people are like, how could you have missed the fact that they were on that drug, and that drug doesn't go with that drug, and it's just. Whereas if you have. If you're doing like an emergency operation and you've got two very difficult options, and you go for one option rather than the other option, but it was a heat at the moment and you're trying your very best, it wasn't an omission. It almost seems like a mistake, which is, more tolerable. But
yes, understood.
Technology has the ability to revolutionize safety, I think. So those are the two key things that we're driving at the moment from our technology strategy. That said, as I love innovation, and I very often get distracted, as Nicki will more often than not say, and sometimes I'll head off chasing some fancy bit of kit. But I'll pass on to Nicki now from the hospital.
Well, that's very helpful. Iain, thank you very much. And it's great to hear, like I said, these absolutely practical, real-world experiences directly from people who are delivering healthcare and who equally have a very impressive commitment to innovation. So really, really appreciate what you're saying, and I think it's very valuable. Nicki, on those lines, let's say, for example, if I'm an innovator, if I have a new healthcare widget that I have invented, or I have some ideas, what challenges do I have? Is there a front door to your hospital called Innovators Welcome, or who do I telephone?
Well, there is. There absolutely is. So we've got the Innovation Hub, and each our trust is divided up into divisions. So we've got a division for medicine, surgery, community, and research.
Right.
And each of those divisions has got a partner, an innovation partner.
Right.
So that's someone who's a skilled in the development of innovation and the support, and they're your go-to point, and go and speak to them and say, hey, I've got this idea, can you help me tease it out and get it to a point where I can then start to look at it more seriously. So
Right.
that's how we promote innovation. We also have we showcase the innovations that we do and have innovation sort of seminars and tutorials and so on throughout the organization, so that gets people to understand what's going on and see if they want to join in.
Excellent.
Yeah, I would say also, I mean, I really want to make a point. So you asked us what our strategy is. I mean, our vision, sorry,
Yes.
Our vision is, it's great health for all children and young people. And one of the things that I think that we all need to be aware of is collaboration. And about a year ago, we changed the name of one of our programs. So we do a lot of outreach, and we used to call it Alder Hey at. So it might be Alder Hey at your hospital. And then we realized that maybe wasn't collaborative, really. And we've changed it to Alder Hey with. And just changing that one word from at to with has had an enormous effect on our relationship with the hospitals around us. Yes. That we've really struggled to engage with. But now they're saying, well, you're working with us, you're not telling us what to do. And it's resulted in a partnership with a local hospital where we're using immersive technology for ward rounds, and we're helping them set that up, because they have a lot of their staff are of Black and ethnic minority groups, and they're also in an area where they really are one of the hottest spots for COVID in the country. So now we're helping them do virtual ward rounds so that their staff are safe but can continue to work and provide care. And I think that's because we've said with, not at. So I think collaboration really, really important.
Yes. Nicki, thank you for adding that. I mean, clearly the theme of buy-in, so to speak, is unbelievably important for collaboration. And it's exciting to hear how you guys are even innovative in your use of language, and you're open to changing your use of language from Alder Hey at to Alder Hey with. And very, very gratifying to hear about the openness that you guys have, as well as the results of this collaborative spirit. So that's very, very good news. And I love case studies like that. And I'm certain all of our listeners from around the world will find that very interesting. So I hope you don't mind, but unfortunately, we're going to have to wrap up now. To be honest with you, I'd love to continue this conversation over a pint of Guinness with you for about the next 2 hours, but I think we'll have to wait until the pandemic is over. But on behalf of everybody at the Giant team, and quite literally on behalf of everybody who is participating in the Giant Health event this year, as you know, we're a global community. We're nearly 200,000 people around the world. Our informal strapline is everybody whose business is healthcare tech innovation. I'm sure that I can say on behalf of everybody a very, very large and grateful thank you to Iain, and thank you to Nicki. Really glad to have you guys on board. We value your time. For me personally, this has been an extremely interesting and informative conversation. I've already learned about 4D printing, so I've got a new bit to my vocabulary. And I'm also glad to hear that people who are in their 80s and 90s, like myself, are still respected and can be considered to be worthwhile and able to make a contribution alongside all the young people who are using TikTok and Snapchat and all those other innovations. So, Nicki, thank you very much. Really, really good to see you, and great to have you on our show. And likewise, Iain. And congratulations to both of you. We're very proud of the innovations that you guys are doing, and we're very, very proud to have the privilege of championing the Alder Hey Hospital Innovation Hub. So thank you for that.
Thanks very much.
Good luck with everything.
Thank you.
Thank you.